But I'm going to take you away from the lab, and then we're going to travel quickly to the community. In my talk on gender differences in sociocultural determinants of antibiotic prescription in Southwestern Nigeria. This is part of my PhD from the University of Kent, as it's been mentioned. All right, globally, antibiotic consumption is increasing from the Kent study in 2018 by up to 39%. And there's a recent data in 2023, 11% more increase, although that's biased by COVID. But we see that most of the increase is driven by use consumption in LMIC, up and low middle income countries like Nigeria. And unfortunately, most of these use in these countries in the LMIC, like Nigeria, are unprescribed. They are non-prescription antibiotic use. And up to 79.2% prevalence in some studies in Nigeria. I said unfortunately because we understand the implication of non-prescribed antibiotics on antimicrobial resistance, which is probably what most of us in this auditorium knows about. So I quoted Tom Fedrin, the former US CDC director, that says if we use antibiotics when not needed, we may not have them when they are most needed. So it's important for us to look at how non-prescription antibiotic, the dynamics, in underlying non-prescription antibiotic use. And from studies, we see that antibiotics are not only used for medical reasons, there are also some sociocultural drivers, fueling antibiotic use. And in September 2024, we have the UN General Assembly, having a target of 20% reduction in inappropriate antibiotic use. And so situating this research under UN SDG 3, 5, and 10, we looked at the sociocultural determinants of non-prescription antibiotic use in Southwestern Nigeria and, from a gender perspective. So the methodology, we conducted a quantitative and qualitative study using a mixed method research design, collecting data from 509 respondents from 15 communities in Ibadan, in Nigeria. And then we also conducted focus group discussion and interviews from men and women in the community, from health workers as well. Now, the characteristics of the survey shows that there were more women, slightly more women in the survey, and more than half of the respondents had tertiary education, more are married, and then most of them are in monogamous relationship, and then unfortunately just about 13% had health insurance. So we asked questions about the sociocultural, the lived experience and sociocultural drivers. And then we realized that almost 60% of the respondents indicated that when men report symptoms of infection early, it is termed as weakness. And so more than half believe that it's a weakness for men to report infection symptoms. And then when they complain about infection symptoms, not complaining is seen as a sign of strength. And then women are also almost 3/4 of respondents said that women are expected to report infection symptoms earlier than men. But also we got about 2/3 reporting stigma experience for women. Now, so looking at antibiotic use between men and women from the gender perspective, we realize that more women use antibiotics than men. Asking questions about antibiotic use in the last 3 months. So more women, although this is not statistically significant, but we realize that more women. The second graph shows that although more women use antibiotics than men generally, non-prescription antibiotic use is higher among men than women, and that is statistically significant. We also ask questions about the frequency of antibiotic use. So if you look at never, there were more female that had never used antibiotics, the frequency, and then we also had occasionally more women, but talking about now, going further to more frequently, we see that more men use antibiotics more frequently than women, and also the same for most of the time and for all of the time. So we see that men use antibiotics more, non-prescription antibiotics more than women, and also the frequency of use is more among men than women. Now, the qualitative results shows we identify 6 themes under the qualitative results, which are the factors that drive non-prescription antibiotic use that we saw earlier in the earlier slide. So gender, labor, and roles, which is related to the exposure, the infection exposure, the economic capability, and then the time you have to go to health facility, to procure prescription antibiotics, and the time, the access. So we see that also the gender biased healthcare system. I'll talk briefly on this. From literature, we see that more women prefer to go to health center, to health facility to access antibiotics, but when the health provider is a woman. But in this study, we realized just from the young female there that also males being male is actually synonymous with being authoritative and being able to give better advice. So economic disparity, stigma and discrimination, household dynamics, and then the perception of masculine and femininity. I also talk briefly on that, as seen by the quote there, the second to the last quote. As a female, I wanted to be attracted to men. So there is this societal pressure of being attracted and being, being feminine. So which has to do with use of antibiotics and, as purifier, as blood cleansing. So we see here from our study that antibiotics is not only used for medical needs, but also driven by gender norms. And then here I've prescribed some recommendation right there. So if you have further questions, you can catch up with me during the break. Thank you very much.